Hello, Dr. Panantoni here. I wanted to discuss a little bit about one of the most common conditions we see here in our clinic, which is the carpal tunnel syndrome. So carpal tunnel is, to make it simple, is just the tunnel where all the tendons and the nerve will pass inside of your wrist. So if you look into your wrist like this, inside there will be all the tendons, like a transverse cut of the wrist. You have the bones on the wrist on the back side, the extensor tendons on the back of the hand, and the flexor tendons together with the nerve. So to make it simpler, there is a little drawing for you here, just showing the bones on the wrist, the flexor tendons, and the median nerve. The median nerve is what gives sensation to the fingertips and also power to some of the muscles on the hand. When the nerves start to get compressed, you can start to have some numbness and tingling in your fingers, and this is common to happen at night because when you're sleeping, your muscles relax, and this can make your wrist go into flexed position, and this will increase the pressure inside of the carpal tunnel, and that's when you wake up feeling numbness and tingling in your hand. If this persists down the road, this can cause some muscular wasting or weakness on the hand, and the idea is not to let the carpal tunnel get to that point, get to a severe carpal tunnel. So I like to draw to make it simple, for the patient. So if you think about the carpal tunnel as being a tunnel, and then inside you have the bones on the wrist. These bones are going to be on the back of the carpal tunnel. And then here on the back, on top of the bones, you have the extensor tendon. So if you look your wrist like this, and then we have 9 tendons for all the fingers and the thumb. So this is a tendon for the thumb, and then 2 tendons for each finger, 9 tendons total. And all these on the same space, we have all those tendons and the median nerve. So the median nerve here is the one that, when compressed, can cause problems that we call carpal tunnel syndrome, right? So that's the median nerve here. So when you start to have swelling on the tendons, either for overuse, or sometimes it's hard to pinpoint the reason for it, or if you have the roof of the carpal tunnel that starts to be too tight, there will be a compression on the median nerve. So here you can see the swelling on the tendons. The tendons end up getting bigger. That's what we call tenosynovitis, inflammation on the tendon. And then this will decrease the space for the median nerve. So if the compression is right here, the median nerve will get swollen right next to it, right proximal to it, as we call, and will form like a hourglass deformity. So that's the thing that we're going to be measuring with the ultrasound. Increased diameter or cross-sectional area on the nerve that can be measured